Hi, my name is Maggie, and thanks for joining me today while we talk about an instructional strategy in nursing that is near and dear to my heart called high fidelity simulation. What is high fidelity simulation in nursing? So, it is a central component of pre licensure nurse education where students have an opportunity to play the role of RN in a real life clinical scenario for typically an acute care hospitalized patient. These are pass fail performance exams that reinforce content that was previously taught in lecture, but in a low stakes environment in which only a mannequin will be potentially harmed. In the background, students' progress towards learning goals are monitored by clinical nurse educators behind two-way mirrors as they perform psychomotor skills, clinical assessments, and respond to the clinical scenario. These mannequins are completely lifelike. You can place an IV, you can place other catheters, you can measure their blood pressures, you can talk to them back and forth. They can indicate that they're experiencing pain. It's the real deal. One of the leading theorists on this more sort of newer modality, teaching modality in nursing, is Catherine Bailey. She actually is the chapter author about high fidelity simulation in one of our graduate level textbooks. And Dr. Bailey offers a really good argument that simulations like this, that are really lifelike and basically mimic an exact real life example of what you would do as a staff nurse in the hospital, it provides opportunities to practice necessary patient care skills in a safe environment. Students are always going to be scared of hurting a real person, especially if you're going into nursing for the right reasons. You don't go into it to hurt people. And getting those skills on a mannequin first before practicing on you or your loved one is key. So, how does simulation work? Students typically participate in 3 to 4 simulations each semester, and sort of combined with unit exams as a summative assessment. Simulations tend to sort of mimic what the professors have been lecturing on in the prior weeks, meaning you'll probably have a cardiology scenario in your sim if you had been reviewing telemetry for the last 3 weeks. And similarly, if you spent a lot of time on respiratory and things of that nature, then you can probably bet that your clinical sim will be about a patient with breathing problems. Each student plays the role of the lead nurse at least once each term, and other students play supportive roles and receive delegation from the lead RN, so that way everyone is still practicing skills and making decisions and reporting off in each scenario. Behind the scenes, your clinical nurse educators are there to support you, observe, make sure that progress is being made, and then also act as a resource, similarly to your life as a day-to-day nurse, where you can always ask your charge nurse or your manager. There's a lot of good current research to say that high fidelity simulation is becoming the gold standard. One 2023 study found that students who participated in high fidelity sim actually performed better urinary catheterization with better sterile techniques than their peers who did not. Another study found that students who had opportunities to practice what to do in an emergency really reduced their anxiety and increased their confidence before they entered the clinical workforce. And a third study found that, again, using high fidelity simulation improved overall problem solving skills in even just in first year nursing students, which is a really big win. There are many students who graduate without those skills. Overall impacts on student learning are really positive. Overall, students are better able to apply theory from the classroom into their work at the bedside once they graduate and pass boards. Any opportunities to reduce anxiety and improve confidence is going to lead to more resiliency in our nursing workforce. A lot of nurses leave after the first year just due to the severe stress and a lot of emotionally charged situations in the workplace. So anything we can do to help prepare them is going to mean a lot. teaching in a low-risk, high-reward setting like high-fidelity simulation is going to be absolutely crucial as more hospitals begin closing wards, and some hospitals are closing completely, and that means that we're losing clinical placements in the community for real-life patient care experience. Some challenges with high-fidelity simulation are mainly related to cost. As you can imagine, building a simulation lab with all the bells and whistles, including hospital beds, IV poles, Alarises, even just computers to practice charting on, is incredibly expensive. Just one adult high fidelity mannequin, one that can produce a blood pressure, is capable of giving blood return to certain injections and things of that nature, can cost over $35,000. And that's just the equipment itself, and it doesn't include the cost to staff the lab with clinical nurse educators. And just the staffing cost alone can be over hundreds of thousands of dollars per year. Then schools also have to budget for the ongoing costs of that medical equipment, like IVs and gauze. And as you can imagine, if a student makes a mistake when preparing a sterile injection, you need to start all over again. And ideally, that would be opening a new package and preparing the sterile field again. So sometimes one procedure can take 3 kits. Also, the communication equipment, the two-way monitors, and the microphones, and all are big IT investments. Some community college and state university systems can't afford these teaching modalities just because of slim budgets. But despite the costs, high-fidelity clinical sim is a proven instructional strategy that builds confidence in both assessment and psychomotor skills well before students graduate into real-life patient care with you or your loved ones. Students report high levels of satisfaction when they complete sims and improved ability with their clinical skills and decision-making abilities. This is reflected every day when you're a bedside RN, where you are the person who's spending the most time with the patient. The doctor's there for maybe 5 minutes. The rest of the time you're there. And you're the one who's trying to make those judgment calls about, do I call the physician? Do I activate my chain of command? Is this symptom worthy of X, Y, or Z response? So simulation is really helpful in helping students build those skills. And overall, high-fidelity clinical SIM really should be a cornerstone of every accredited pre-licensure nurse education program. It may be less value in a master's program, especially a master's program where students have been in the clinical setting, or not students, but graduates have been in the clinical setting working for several years. Simulation is less applicable to those students, more to pre-licensure level students. And here are the listings of those 3 studies that I mentioned, as well as the textbook with the leading theorist who worked on this modality. Thanks for your time and attention.